Right now I have four main areas of collaborators. One of them that is very exciting to me is the University of California, Los Angeles. There are two investigators there, Dr. Julie Bauer and Dr. Elizabeth Breen, who have done a lot of work looking at biomarkers of inflammation related to fatigue in women with breast cancer. And they have been willing to partner with me in some of the research I've been doing for fatigue to look at those biomarkers as a result of using American ginseng to treat that fatigue. And we are beginning to share the results of that work this summer at a couple different symptom management conferences, and continuing to do work with those biomarkers of inflammation as well as other physiologic markers to really try to understand what's causing cancer-related fatigue so that we can have better studies to target interventions for those problems. Another collaborator in that same area but for a different physiology is Dr. Clemens Kirschbaum from Germany. He is one of the internationally known people for salivary cortisol and what cortisol does physiologically in the body. So he's been analyzing our specimens for cortisol content and partnering in manuscripts with what that means related to fatigue. Then I also have a collaborator in the fatigue arena, Dr. Andrea Barsovic from Thomas Jefferson University in Pennsylvania, and she and I are looking at a study to evaluate fatigue over time, over a 2-year period in people getting diagnosed and treated with colorectal cancer. And I'm bringing that physiologic expertise to our study, and she's bringing a behavioral expertise to our study, and we're going to look at the interplay, if you will, of both behavioral predictors and physiologic predictors for fatigue long term to be able to really predict who has problems long term with cancer-related fatigue and what we can do about it. So I'm very excited about that collaboration, and that's new. Then for something totally different, I'm collaborating with Dr. Gary Elkins from Baylor University in Waco, Texas, and he is a psychologist and a hypnotherapist, and he's been teaching both myself and a couple colleagues here hypnosis. We started learning hypnosis for hot flashes and have completed some studies with that have been very successful. And now we are taking that hypnosis intervention and moving it into the fatigue arena and also the sexual health arena. So for fatigue, we're giving suggestions or looking at suggestions for improving energy and improving sleep, which also helps fatigue. And for sexual health, we're looking at suggestions to improve sexual self-image, which we know that people, women particularly after surgery for cancer and treatment, have a lot of body changes that can negatively impact their self-image. So through hypnosis, we're going to try to give that some enhancement to make them feel good about themselves and back to relating to their sexual being. So in the future, my research is going to focus on two distinct areas, and that is to solve the cancer-related fatigue issue as well as to improve sexual health. I'm working on a 3-component intervention for sexual health. The first component is for vaginal atrophy, vaginal dryness, which is finishing up this summer. The analysis will be done and we'll know whether we have that piece figured out. Then adding to that, as I mentioned, is the hypnosis intervention for sexual self-image, which we're just in the pilot phases of getting that intervention really well understood. And then the third piece is really dealing with the sexual energy or motivation, which is what I call it. Other people call it libido. I think it's a little, in cancer survivors, I think it's a little bit different than libido. It really is more, has more of a fatigue bent to it. So I have an idea for a study with a medication that's used in sexual medicine clinics to see if that helps cancer survivors improve their sexual motivation and energy. So those three things are being done separately, but then the goal is to put them together in a package of interventions for sexual health, so that as we, as nurses and other healthcare providers, meet with women who have expressed a decline in their sexual health, we can assess what their specific issues are, and we can add in pieces of that intervention that meet their specific needs. And then by more holistically addressing the issues related to sexual health, we can actually have some larger impact in that outcome. And then on the fatigue side, as I mentioned, my collaboration with Dr. Barsovic in looking at fatigue long term, my goal is to truly dig in from a physiologic perspective and to understand what's happening in long-term fatigue in cancer survivors, and then to continue my intervention work to deal with that. Having just finished a large multi-site trial looking at ginseng for cancer-related fatigue, it did have some activity. So now we're looking into what exactly is ginseng doing in the body, and then hope to, as we understand the physiologic effects of ginseng more, and then on the other side understanding the physiologic expression of cancer-related fatigue, really honing that ginseng intervention better and more specifically to deal with some of the physiologic fatigue findings that we have. So, and then adding behavioral interventions to that as we go along, as we understand really the limitations of ginseng and what it does, and then the full needs of the physiology and the behavioral expression of fatigue. So I think both of those things together, I have a list of studies that need to be done that will probably take the next 10 years easily.